Hello everyone, you're watching sqadia.com and I am Hamad Haider. Today our topic is neuromuscular disorders. Although diseases such as poliomyelitis have almost been eradicated except from the few countries, but what yes we are seeing now are some problems related to post-polio syndromes, and then there are also associated problems with brain and degenerative diseases of the brain, especially associated problems with Parkinsonism, Gates, Jumelia. Then there are associated issues like spinal cord problems, for example, central cord syndrome, Brown-Séquard cord syndromes, and all these. And these all constitutes under the umbrella of neuromuscular disorders. So if we are approaching a patient with neuromuscular disorders, then how we have to proceed? And in this section, actually, we are going to go through that. We'll be in the first section going through the clinical assessment, that is how to take the history and do the neurological examination of that patient with the neuromuscular disorders. And the first and foremost in orthopedic is actually the gait disturbances. How to assess the gait and what are the differentials of how the problems are coming up with. Then in the second section, we'll be going through the motor power and then investigations, how to actually do the muscle charting, which are the typical muscles which need to be looked out for to identify different lesions at different levels of the spinal cord. And then in this section, we're also going over the imaging and investigations we need to perform, especially electromyography and NCS. In the third section, we'll be deeply going through the neurophysiological studies of EEGs, the diagnostic evaluation of the patient, and especially the intraoperative neurophysiological techniques as well. Because nowadays, it's not just that diagnosing a problem whether the patient has a central nervous system problem or a peripheral nervous problem. Then also that we need to be sure about it, that when we are treating a disease for a different pathology, for example, if a child is undergoing a surgery for scoliosis, there is always a chance that per operatively the too much correction can be done, resulting in some kind of a nerve impairment, and post operatively that child may present with a problem which was not initially present. Therefore, intraoperative neurophysiological studies have been developed so that this kind of disasters don't happen. In the fourth section, we'll be briefly going through the motor neuron disease and briefly touching the signs and symptoms of poliomyelitis. In the last section, we'll be going through the post-polio syndrome, which is actually the real problem we are facing now, because now polio has been eradicated from almost whole of the world except few countries. But yes, those who have been affected with the polio at some point in their life are actually presenting with post-polio syndrome, which is actually a problem nowadays. Thank you very much. Keep watching sqadia.com.